the Minister of Health, Honorable Sylvia Masebo, the Permanent Secretary, Administration in the Ministry of Health, Professor Christopher Simonga, other ministry officials present, other senior government officials that are present here, I recognize you. Stanbic Bank management that is present here, members of the media, should I simply say ladies and gentlemen. Good afternoon to all of you once again. I would like to start by commending the government through the Ministry of Health for the efforts that have been put in place in tackling the cholera outbreak that has claimed over about 500 lives since it broke in October 2023. Honorable Minister, we know it's been a lot of work, but what we'd like to say, I think, from the private sector is we'd like to thank you for your efforts in handling the pandemic so far. Honorable Minister, Stanbic Bank firmly believes in the principle that a healthy nation is a wealthy nation, and this is why, in aligning with the government's agenda of maintaining the country's surroundings clean and green, we ramped up our contribution to the Keep Zambia Clean and Green campaign, which was obviously ignited and started by government, by partnering with the local councils and other stakeholders to clean the central business districts, areas of Lusaka, Ndola, and Chipata. And this was before the outbreak of the cholera disease that we are experiencing currently. Our efforts in this exercise resulted in the collection of over 22 tons of solid waste, of which 14 tons was then incinerated. The amount spent around the cleaning of Lusaka, Ndola, and Chipata CBDs was in excess of about 500,000 kwacha that was spent last year. And we'll continue, Honorable Minister, with this because it's a preventative way of looking at the situation that we have at hand. This year, we will collaborate again with our partners on this cleaning exercise, and we'll extend this to Livingstone, Solwezi, and Kitwe. Today, on behalf of Stanbic Bank, Honorable Minister, we join hands with like-minded organizations and would like to contribute to this unified effort aimed at ending the cholera outbreak that has affected our people and our communities. In consultation with your ministry, Honorable Minister, we are here to hand over assorted goods. There was a list that was provided to us, and we heeded to the call of the ministry. And these goods are worth 300,000 kwacha, and this is to intensify on the measures that are being taken to mitigate the risks of contracting cholera, even for the health workers that are here. And it's important for us to protect the people that are managing the patients that are here as well as to clean the surroundings that we have. This donation is aligned to our CSR focus on health and is designed to benefit the most vulnerable in our communities. Honorable Minister, furthermore, would like to add our voice in urging members of the public. We heard from the minister just now that we need to take heed of the medical advice that is being given. And the health authorities are doing their part. It's also our part as the private sector, as citizens and as individuals, to play a part in making sure that we do not have this disease escalate any further. And therefore, we are also asking that if there's any symptoms that are seen by anybody, please do seek medical attention as soon as possible. I also take this opportunity to commend other cooperating partners who have come before us and the ones that are watching this to come on board. Basically, we need to ensure that we keep donating materials and funds to the Ministry of Health to help in mitigating the risk of contracting the disease, as well as managing the disease itself. In closing, I'd like to extend our sincere gratitude, Honorable Minister, for providing us with this opportunity to come on board and render assistance to the government through your ministry in eliminating cholera and other similar waterborne diseases. We thank you for your efforts, Honorable Minister. Thank you.